Leyla, thank you very much for coming in. This is what really interests me, is that trust has broken down because there's been an effort to overstate the safety of medicines, and all medicines have a risk of side effects. Vaccines do, even aspirin. I would always take an aspirin rather than paracetamol for personal preference, but aspirin is, according to an Oxford study, responsible for 3,000 deaths a year in the UK. So it's not a risk-free thing to do, and that governments and experts need to be more honest with the public.
Well, that's definitely true, Jacob, that medicines have, risks associated with them as well. But what we need to be doing is to go based on science and facts. And with regards to the statements around paracetamol and pregnancy, a study by Swedish University demonstrated only last year, a massive study actually, that paracetamol is not associated with autism. So I think there is an onus on politicians to, when they talk about these things, that it is absolutely based on facts.
I understand that, but I helped constituents who had been affected by Primados. And the cover-up over Primados, which is quite extraordinary, a drug that was used for pregnancy testing but turned out to be an abortifacient, was done in such a way that it undermines trust. And people, every time a drug is challenged, the experts come out and say, all studies show it's perfectly safe. And then you discover some years later that there may be risks. And that's the thing that worries me, that the assurances are so sort of blasé. It's, don't worry, it's all fine, nothing to see here. And don't you think people need to know more, that there may be, I don't know, 1 in a million risk with paracetamol? It's to allow people to understand what may happen.
Well, I think as healthcare professionals and scientists, we've been quite honest that there are risks involved with medicines. They can harm as well as they can heal. However, in this situation with regards to paracetamol and pregnancy, we've got to look at facts. And this medicine has been used for many years and is, according to NHS, the safest medicines for use in pregnancy. You can just imagine a pregnant woman watching that press conference, how worried they will be if they've taken a paracetamol for headache or something, and how worried that will make them.
I understand that, but when the issue of COVID coming from the laboratory in Wuhan was first raised, the WHO, the body you'd expect to be independent in investigating it, actually turned out to be an outpost of the Chinese Communist Party and dismissed these suggestions and said, nonsense, don't think about it. Whereas now most respectable opinion thinks that it did start from a leak from the laboratory and that it's this fundamental collapse in trust of experts that is so dangerous, and that bland assurances aren't good enough. The experts need to rebuild trust by perhaps being more forthright and explaining the risks more carefully.
Well, absolutely. And, I'm talking from a pharmacy perspective. I'm a clinical pharmacist. And from our perspective, we are always very open and honest. If people ask us about medication, we tell them the risks involved with it as well as the good things involved with it. But we have to look at the facts that we currently have.
So what is the risk of paracetamol? It's very easy to overdose on, and that's why it's in small packets. What other risks are there? The consequences for the liver if people overdose on it?
Yeah, absolutely. So paracetamol, if taken as sort of the recommended dose, can be very harmful and in some cases absolutely fatal. So there are, serious risks involved with it. But in pregnancy, if taken according to the recommended dose, it's proven to be safe compared to any other painkiller.
Safe compared to any other, but what level of risk does that mean? What is the worst thing that could happen? And how often does the worst thing happen?
Well, the studies that have shown so far, including the one that was carried out in Sweden with relation to autism, what Donald Trump was talking about, demonstrated that there's very little risk, associated with that. That there's no, really, when you look at the whole cohort of people that they looked at, including the siblings, that there was no association with autism.
Calvin, let me bring you in, because this issue of trust, I think, is fundamental. And actually, it's beneficial if people do trust some experts. But the experts destroyed the trust themselves.
Right, but the issue really, the trust comes out the fact that social media is involved. And directly you get social media involved in these kinds of debates, you will always find a percentage of people who are going to be naysayers about this thing. For instance, in my particular case, I decided, ludicrously as it turns out, not to have COVID jabs, OK? to have the COVID vaccine, right? What did I get? I go to Washington and I get the worst dose of COVID I've ever had, and I was flat on my back for about a week. So I actually don't buy this. However, I wouldn't like to have shares in Tylenol right now.
Michael, let me give you a quick word.
Well, I hope this is not a leg pull by Trump. Actually, it's serious, because there will be people who won't be taking paracetamol and Tylenol as a result of this.
Correct.
Won't be going to work. It'll have an economic effect. It could have an effect on people, on women giving birth. But I think actually Kelvin's right, and the one mix we've got in this debate is conspiracy theories. The social media has encouraged conspiracy theories. The more outlandish they are, the more hits they get, and all of that. And that's what I think this has led to this.
But Wuhan was dismissed as a conspiracy theory, and the conspiracy theorists will come back at you and say, that's the problem.
History shows every now and then the conspiracy theorists are right.
OK, well, in a statement, the maker of Tylenol, Kenvue, said the science clearly shows that taking paracetamol does not cause autism. The company said, we believe independent, sound science clearly shows that taking acetaminophen does not cause autism. I assume that's paracetamol. We strongly disagree with any suggestion otherwise and are deeply concerned with the health risk this poses for expectant mothers. Well, thank you very much to Leyla and to my panel.